Hey, good morning, everybody. This is John here, posting a video for week one. Hope you're all doing well and welcome to the class. Um, I will post a video each week, typically on Mondays, to sort of recap what we discussed and what we studied from the prior week, discuss any collective feedback for all the students. For that week's assignment and to sort of dive into the new module for the upcoming week. So I'm going to go through just sort of an introduction today of some of the concepts that we'll be discussing throughout this class. And then at the very end, I'm going to give you some of my tips, some thoughts on how to be successful in this class. I've taught this class for almost 2 years now, and have seen sort of a pattern on what it takes to be successful in here. So hopefully you'll take note of some of those things. So I'm excited to teach this class. I love teaching this class, healthcare law and ethical considerations. As you know, many of you historically, I haven't checked your backgrounds yet, but historically in this class, we get people who are either current practitioners, they're studying to be some sort of practitioner, they're in some sort of position with a healthcare company or hospital, maybe administrative position, and they want to uh, sort of progress their career through an additional degree, which is fantastic. And uh, so basically. Historically, there's been a lot of people with experience in the healthcare field, which has definitely provided a lot of value in our discussions. And as people with experience in healthcare, I mean, even if you don't have experience in healthcare, I think it's pretty clear that the idea of ethics permeates the healthcare field, and there are many legal considerations. It's a highly regulated industry. In terms of ethics, simple things like is healthcare is it a right or a privilege? Is it all the end of life issues that come up, and many people have their own personal experience with end of life issues. That's something that we'll be discussing throughout this course. Even in insurance coverage, even things like pre-existing conditions, which you hear a lot about in the news today. In fact, you probably hear a lot about healthcare policy in the news because we're right in the middle of an election cycle. That's typically when it comes up. The ethics conversations, even maybe now more so today than ever, can quickly turn into a political discussion, which we really try to avoid in this class. We're just here to talk about. Many times we talk about our own opinions. Many times we talk about concepts that we study in class, and those are important. Everyone has their own opinions, and those opinions provide value to the discussion. And so, one thing I would ask is that we keep our discussions respectful, that we allow others to have opinions that we may not share, and that's okay. We can respectfully provide our own opinion, which is fine. There's only been one time in 2 years that I've had to ask a student to retract or just talk to a student about a disrespectful comment. So that's not something that typically comes up, but I like to bring it up at the very beginning. So we know the expectations, because we are, whenever we talk about ethics, particularly on an issue that is certainly infused in politics, it can certainly come to that, which we definitely want to avoid. Some of the issues we discuss in this class I really enjoy. They're really exciting. Um, just for a couple examples, I like to pull out of the text. We're going to talk about privacy and confidentiality of protected health information, um, which we'll discuss. I think that's the week 4 discussion. But this is an issue from your textbook, which I really like. The physician from another office steps into your office and asks to see the chart of a neighbor whom he believes may have an infectious disease. He states that the neighbor is a good friend and that she will not mind if he reviews her medical chart. Is it legal for you to give the chart to this physician? So, I mean, the question is this permissible? And maybe an underlying question or an offshoot question would be, should it be permissible? Um, the one thing in this class that you'll find is very important is analysis. And so, when you're asked questions or there are discussion questions, or even in our assignments, um, I'm not, I am not concerned with getting the right or wrong answer. To me, uh, there's really, there are no right or wrong answers. There are reasonable answers, and reasonable answers naturally come up after you have a reasonable analysis. And we'll talk more about analysis later. But the key in this class you'll find is the depth of the analysis. If the analysis is there, the conclusion will be reasonable, and that's all that really matters for purposes of this class. We're not here for right or wrong answers. We're here to learn how to think critically about these issues and to analyze these issues. What about someone who presents to an emergency room and needs urgent care? Some of you may work in emergency departments. What if the person doesn't have insurance, or that particular uh, emergency department is out of network with the patient's plan? Is it legal or ethical to turn away a patient who's in need of emergency care? Another question from your textbook. Well, this is a great example that I use to sort of describe how ethical considerations overlap with legal considerations, because I think a lot of us would say that no, it's not ethical to turn away someone who's in need of emergency care for an emergency department, regardless of the insurance or situation or the ability to pay. That collective ethical concern has been codified into a law called, as many of you know it, I'm sure, it's called EMTALA, the Emergency Medical Treatment and Active Labor Act, which basically prohibits emergency departments from turning people away without providing medical screening and some life-sustaining care. And they're not allowed to ask about insurance coverage or anything like that. So that's a great example of how an ethical issue, something that we're really concerned about as a society, eventually turns into a law. We'll talk about false claims, reverse false claims, physician disciplinary cases, scope of practice, ethical issues related to that. I'm not a malpractice, I'm not a medical negligence attorney, although that's the focus of this class. I'm a healthcare regulatory attorney, and I deal a lot with the business of healthcare. So we'll talk, even though it's not a huge emphasis in this class, we're going to talk a little bit about some of the regulatory issues, some of the business side of healthcare, and which is always exciting. I'm sure you're super looking forward to that. We're going to talk a lot about risk. Risk is such an important concept to understand in the healthcare field. A lot of times when I give legal advice to providers, sometimes there is a wrong answer, right? And sometimes there's a one right answer, but that's really the rare occasion. What happens more often is a provider will approach me and say, okay, I want to do X, Y, and Z. And when you do a little bit of research, you understand, well, you could do this. The law is not clear, but here's the risk associated with it. So sometimes there may be 3 different ways to approach a legal issue, and from on a spectrum of risk, from most conservative to most liberal. And the right way to look at this is, okay, how do you achieve your objectives while trying to minimize risk as much as possible? So we're going to talk a lot about risk, not in the business of healthcare context, but in the medical negligence context. So it'll be important to really dive in and understand that concept. So I want to sort of go just an overview of the class. So you'll find that everyone is studying the same case, so there's no confusion. We're all studying this Ituraldi versus Hilo Medical Center case. And this class is broken up into two distinct components. The first component will be the legal component of that case, and we're going to analyze the legal issues in that case. It's very important to understand the facts of that case, to read through that case, um, for completing these assignments. The second half, the second component will be the ethical side. So what are the ethics issues? What are the ethical issues? Uh, what the principles and theories of ethics that we'll study here in the first week or so. How do they apply to the ethical issues in that case? So it'll be important to understand that. But we're all studying the same case. Okay, so now it's time for my keys to success. I apologize. My phone's going off. Okay, number one, again, this is just from my experience in teaching this class for a couple years. Number one is really engage in the class. I think that's really important. Those that don't really engage in the class and have fun with the material, engage with other students, tend not to do as well. And it's not because I grade any less. I mean, if you complete the requirements, if you meet the rubric requirements, that's fine. But I find that this is a class of engagement. We're talking about opinions. We're talking about legal issues, thoughts on risk mitigation, um, and so it's really sort of designed to have good student engagement. So please engage in the class. Number two, turn in assignments timely. I think that goes without saying. I'm happy to work with people. I know I totally understand. Um, I have a full-time job. I teach this class, and I have 3 kids, and I know times can get crazy. So I'm happy to work with people, but please make our best efforts to turn in assignments timely. Number three, watch these videos, not because I frankly care about being seen by anyone on a YouTube video, but I think it's helpful. I think that those that consistently watch these videos find that my feedback is helpful in how to think about the different assignments, how to think about the analysis, what I want to see in the analysis, although I'll certainly put that in writing in our announcements each week as well. But I think it's beneficial to review these. They're no longer than 15 minutes or so each week. Like I said, the key in this class is learning how to do an analysis, and we're going to focus on analysis. You're going to hear me say this over and over and over again. You might hate me because you're sick of hearing this word analysis. You'll find in your textbook there is a way to do legal analysis. It's called the IRAC method, IRAC. You cite the issue, cite the rule, apply the facts to the rule, and give me your conclusion. So I is for issue, R is for rule, A is for application of facts, and C is for conclusion. It's a formula. It's a formula for legal analysis, and it's very simple, but it needs to be done. For each issue, there's a rule. And then there are facts that can be applied to that rule. And then based on that analysis, you can come up with your conclusion. And again, there's no right or wrong conclusion. There are only reasonable conclusions based on your analysis. So that's why the analysis is so important. So this class is all about analysis. For the legal issues, legal components, there are elements that for the medical malpractice, which is the main issue on the legal component side. There are 4 different elements to a medical negligence claim. I need to know what those 4 elements are, because even if one element is not there, then there is no negligence. There is no medical negligence. So I think your text refers to them as the 4 Ds. So look that up, and all 4 of those elements have to be part of that legal analysis. Follow the rubric. I grade by the rubric. I just go down pretty much almost all the assignments. There may be 1 or 2 that don't work really well with rubric grading, but for the most part, I just go by what the rubric says, and I go by what you write, and then grade that way. So please follow the rubric. I think that's it. The biggest thing is the analysis piece. We're gonna analyze each element of legal issues, and it's really important to follow that IRAC form of legal analysis, because that's how a legal analysis is done. So that's it for me this week. Please, 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 please feel free to reach out by email, text, however you want, phone, and let me know if you have any questions or concerns. I hope you have a great class. I hope you get value out of this class. That's my main objective throughout the next 8 weeks, is for you to find some value out of this class, because I think the skills in terms of analyzing issues and thinking about issues critically are applicable in a variety of fields, and not just healthcare, but it's just an important skill to have. So anyways, that's it for me this week. I hope you have a great week. I look forward to hearing from each of you on the discussion this week, and look forward to the next 8 weeks. Have a great one.